Hey everyone, and welcome back for another deep dive with us. Today we're going to be talking about something that might not sound super exciting at first, but I promise it's actually pretty fascinating. We're going to be diving into healthcare in India.
Yeah, healthcare in India.
Right. It impacts millions of people and has some really interesting stuff happening right now.
Yes, definitely. Some really interesting trends.
Yeah. So to guide us through this, we're going to be looking at a podcast episode called Healthcare Service Delivery, Transforming India's Healthcare Landscape.
Okay, sounds good.
And by the end, you'll have a really good understanding of how this whole system has evolved in India, what challenges it's facing right now, and also like what the future holds.
It's like a medical drama, but with a lot more data.
Exactly. Hopefully fewer near-death experiences too.
Let's hope so.
So to start, let's rewind the clock a bit. Back to the 1990s. Back then, India's healthcare system was mainly public. Like government hospitals were the main providers.
Right.
Private healthcare was just kind of starting to emerge.
Yeah, it was really limited, especially access to quality care.
Oh, yeah.
Particularly in those rural communities.
I can imagine.
They often had to rely on those PHCs, primary health centers.
Yeah.
Or community health centers, the CHCs.
Okay.
And underfunding and staffing shortages were huge issues.
I bet. And it sounds like that's something that still persists today.
Unfortunately, yes.
Wow.
Yeah.
Okay, so let's fast forward a bit now to the 2000s. This is where we see the rise of like those big private hospital chains.
Right.
Like Apollo and Fortis. Private healthcare starts booming.
Yeah, huge growth.
Even medical tourism starts taking off.
It's true.
And by 2010, private healthcare spending actually overtook public spending.
Wow.
That's a big shift.
Yeah, it's really significant.
So all this growth sounds impressive on the surface, but were there any downsides to this like rapid expansion?
Well, there definitely were advancements in technology,
I bet.
and specialized care, which is great. But it also led to a widening gap between urban and rural healthcare facilities.
Makes sense.
People who could afford it traveled to cities for treatment,
Of course.
leaving many in rural areas with very few options.
It's true. It's like progress doesn't always benefit everyone equally.
Yeah, exactly.
Okay, so then in 2005, the government launched the National Rural Health Mission.
Right.
And later they expanded it to the National Health Mission in 2013. It seems like this was a pretty big step towards addressing those disparities we talked about.
Absolutely. The mission's focus was improving maternal and child health services,
Good.
really bolstering that primary health care.
Yeah.
And reducing the overall disease burden, especially in those underserved areas,
Makes sense.
is a significant commitment to improving healthcare equity.
That's great. Then in 2018, there was the launch of Ayushman Bharat.
Yeah.
And they introduced the Health and Wellness Centers, the HWCs,
Yes.
and PMJAY, a health insurance scheme. So what was the thinking behind launching something so ambitious?
Well, PMJAY, it stands for Pradhan Mantri Jan Arogya Yojana,
Wow.
but it's actually the world's largest government-funded health insurance program,
Really?
covering something like 500 million people.
Oh, wow.
It's a big step towards universal healthcare coverage in India.
So it's trying to make healthcare more affordable.
Right. More accessible.
For sure. So it sounds like they've made some incredible progress, but I know there are still some serious challenges.
Oh, yeah, definitely.
What would you say are some of the biggest obstacles they're facing?
I'd say unequal access to healthcare. It's still a huge issue.
I bet.
You might have cities with all these modern multi-specialty hospitals.
Yeah.
But then some villages don't even have like a basic clinic with essential medicines.
Wow.
It's really striking the disparity.
So it's not just like a geographical issue then.
Right.
It's also about access. So you have these public hospitals,
Yeah,
which are essential,
very important.
but they're often overburdened.
They are often overcrowded. Long wait times.
Yeah,
Staff are overworked.
for sure.
And there are resource shortages.
Because of the vast population they serve.
That's a lot of people to take care of.
Right. And then on the other hand, private hospitals.
Yeah,
They can offer more advanced care,
they do.
but they're so expensive.
That's true. They're prohibitively expensive for many.
Even with schemes like PMJAY.
Yeah, even then.
Wow. Okay, so you have this situation where many can't afford private care, but the public facilities are struggling to keep up with demand.
It's a tough spot.
It is. What about like home health care?
Home health care.
Yeah.
Interesting.
We've seen it growing in India.
Yeah.
Could that be a piece of the puzzle?
Well, home healthcare definitely has potential.
Okay.
Companies like Portea, Care24,
Okay.
Nightingales, they're all offering services in the home.
Oh, wow.
Things like nursing care, physiotherapy,
Yeah.
even doctor consultations.
That's pretty convenient,
It's
especially for people who maybe have mobility limitations or live far from healthcare facilities.
true.
I imagine this would be really valuable in those rural areas where access is already limited.
Exactly. It can reduce hospital readmissions too.
Oh, that's great.
And it provides care for the elderly.
Really important.
However, there is a lack of standardized regulation
No.
and integration with the mainstream medical services.
But that makes sense.
It's kind of like having a really powerful tool, but no instructions on how to use it properly.
Yeah, that's a good analogy. So it sounds like we've identified a few key challenges here: unequal access, overburdened public facilities,
Right.
and this need to properly integrate things like home health care.
Yeah.
So now let's shift gears a bit and talk about potential solutions.
Okay, sounds good.
I think a good place to start would be strengthening that primary health care.
Yeah, I completely agree. We need to make sure that the PHCs
Right.
and the HWCs,
Yep.
they're well equipped, adequately funded. Having all that infrastructure is pointless without the resources to run it.
So true. And of course, we need skilled professionals to staff these centers,
Of course.
especially in rural areas where it's harder to attract talent.
Yeah.
So addressing that workforce shortage is key.
Yeah, it's a big one.
You know, if you improve that primary care, it'll automatically ease the burden on those tertiary hospitals.
Yeah, it's like a domino effect.
Exactly. Imagine if all those facilities were well equipped and staffed.
Right?
So many cases could be managed locally.
It would make a huge difference.
Yeah. All right, so we've talked about like physical infrastructure, but let's get into the digital world now.
Sounds good.
Digital health.
Digital health.
This isn't just hype.
No, it's not.
It could revolutionize healthcare delivery.
It really could.
Right.
Yeah.
So what do you think?
Well, I think it has huge potential. Telemedicine, AI-powered diagnostics, digital health records.
Wow.
All of these can bridge those geographical gaps, boost efficiency, and personalized treatment plans.
That's amazing. During the pandemic, we saw platforms like eSanjeevani
Oh, yeah.
connecting doctors and patients virtually.
Yes. Yeah.
That needs to become like the norm,
I agree.
not the exception.
Yeah. Especially in those remote communities.
Sure.
What do you think?
Well, I think widespread adoption of telemedicine is key,
Yeah,
especially in those rural areas.
for sure.
But we can't forget about basic infrastructure either,
That's right.
like ambulances and emergency services.
Oh, yeah, definitely. Imagine a coordinated nationwide network of ambulances,
Okay.
that are equipped to handle anything
Oh, wow.
from accidents to heart attacks.
That would be incredible. Like a lifeline reaching every corner of the country.
Exactly. Speaking of expanding access,
Yeah.
let's go back to home healthcare for a second.
Okay.
Integrating that into mainstream policy
Okay.
with regulations,
Right. Yeah.
standards.
Sure.
That could be transformative.
It's about seeing how all these different elements are connected.
Exactly.
You don't just build a good healthcare system on one single solution.
No, it's like a whole web.
Right. It's a web of interconnected parts that all need to work together.
Yeah, exactly.
Okay. So we've talked about strengthening the foundation,
Right.
expanding access.
Yeah.
But what about those really advanced technologies
Like what?
like AI and robotics?
Oh, yeah.
Are those just futuristic fantasies?
Well, no, they're not just fantasies.
Oh, really?
They're already part of the evolving healthcare landscape,
Wow. Even in India?
even in India.
That's fascinating. Well, in that case, let's dive into that next. This deep dive is getting more and more interesting.
It is. Yeah. So let's start with AI. Imagine algorithms,
Yeah.
actually analyzing medical images
Okay.
to detect diseases like cancer
Oh, wow.
in the earliest stages, potentially saving so many lives.
So this isn't just like a futuristic concept, then. It's actually happening right now.
It's happening. Yeah. AI is being used for predictive analytics, too,
Like what?
like forecasting disease outbreaks
Oh, wow.
or personalizing treatment plans
That's amazing.
based on someone's genetics and lifestyle.
Personalized healthcare tailored to your DNA? That sounds incredible.
Yeah.
But what about all the data that's generated from these advancements?
Right.
Is it being used effectively?
Oh, absolutely. That's where big data comes in. Each piece of health data.
Okay.
Whether it's medical records or insurance claims,
Yeah.
it all contributes to a bigger picture
Okay.
of disease patterns, healthcare utilization, treatment effectiveness.
So by analyzing all this data, we can make better decisions about things like resource allocation,
Exactly.
disease prevention,
Yeah.
even public health policy.
Exactly. It's about using data to improve outcomes for everyone.
That's great. So we've got AI, big data. What about the Internet of Things?
Ah, yes.
Huh?
The IoT. Well, that involves a network of connected devices.
Okay.
Things like wearable fitness trackers, remote patient monitoring systems, even smart hospital management systems.
I can see how that would be super useful. Imagine doctors being able to monitor patients' vital signs remotely,
Yeah.
catch those warning signs early, prevent those small issues from becoming huge problems.
Exactly. And within hospitals,
Yeah.
IoT can streamline operations, optimize resource use, even improve patient safety.
It's like having this whole support system working behind the scenes to make everything run smoothly.
Right.
Okay, so we've talked about AI, we've talked about IoT.
Right.
What about robotics? Are we going to have robots replacing surgeons soon?
Not quite. It's more about robotics and automation as tools to enhance what humans can do.
Okay.
For example, robotic surgery is already being done in a lot of corporate hospitals in India.
Robots performing surgery. That's
Yeah.
both fascinating and a little bit scary.
Yeah, I know what you mean. But they offer incredible precision,
Okay.
minimizing trauma for the patient
Yeah.
and leading to faster recovery times.
So it's really about giving surgeons these really advanced tools.
Right.
Not necessarily replacing them entirely.
Not yet, anyway.
Okay, good. Good to know. But as with any technology, affordability and accessibility are key.
Yeah, for sure.
We need to make sure these advancements benefit everyone.
Definitely. Not just a select few.
So true. All right, so taking a step back here, if we were to create a roadmap for the future of healthcare in India,
Okay.
what would be some of the key milestones on that roadmap?
Well, first, I think a big one is increasing healthcare investment.
Okay.
Right now, India spends a little over 1% of its GDP on health.
That doesn't seem like a lot.
It's not enough to really make a difference. We need to see that number go up.
Like how much?
At least 3 to 5%.
Wow, okay. That's a big jump. So where would those funds go?
Well, a large chunk of it would have to go towards strengthening primary care.
Right, because that's the foundation we talked about.
Exactly. Imagine well-equipped PHCs,
Yeah.
HACs,
Yeah.
HWCs.
In every corner of the country.
Yeah. Staffed by skilled professionals who want to be there.
So bringing quality healthcare closer to home for everyone.
That's the goal.
Regardless of their location or how much money they make.
Exactly.
Okay. So alongside expanding that physical infrastructure, we also need to embrace the digital revolution.
Right. Investing in telemedicine,
Yeah.
AI-based diagnostics,
Okay.
digital health records.
All that can help bridge those geographical gaps.
Exactly. And bring healthcare to even the most remote areas.
That's incredible. So it's like a two-pronged approach then,
Right.
enhancing that physical infrastructure
Yeah,
and also harnessing the power of technology.
It's the future. What about emerging sectors like home healthcare?
Oh, that's a good point. Where does that fit in?
Well, we need to integrate it into mainstream policy,
Okay.
establish those regulatory frameworks,
Right.
ensure quality and safety. Imagine a future where home health care is just a normal part of the system.
Not just an alternative. I can see how that would be so helpful.
Yeah, especially for the elderly. Of course.
People with chronic conditions, those needing care after being in the hospital.
But even with better infrastructure, technology, and home health care, wouldn't we still face a shortage of healthcare workers,
Right.
especially in those rural areas?
You're absolutely right. We have to address that shortage head on
By doing what?
by training more doctors and nurses
Okay.
and encouraging them to work in those underserved areas.
So making those rural postings more attractive.
Right. Through things like financial incentives,
Yeah.
better living conditions,
Yeah.
professional development opportunities.
It's not just about having enough healthcare workers, but also making sure they're distributed effectively
Exactly. And that they have the support they need.
to provide good care.
Right. And we can't forget about strong emergency services.
Yeah.
We need a nationwide system
Okay.
that can respond to any emergency quickly,
Right.
from accidents to heart attacks.
Like a well-oiled machine.
Yes. And lastly, we need to look at the cost of private healthcare. Right? It's so expensive.
We need transparent pricing,
Yeah.
regulations to control costs,
Okay.
innovative insurance models, all to make sure quality care is accessible to everyone,
Exactly.
not just the wealthy.
Yeah.
So all of these elements together create this roadmap for the future of healthcare in India.
Right.
It's a challenging path for sure,
Yeah, it is.
but the potential benefits are huge.
They are. Is there anything else you think is essential for achieving this vision?
I think it goes beyond policies and investments.
Yeah?
It requires a shift in mindset.
What do you mean?
We need to recognize that healthcare is everyone's business.
What does that mean? Healthcare is everyone's business.
Well, it's about promoting preventative care,
Okay.
empowering individuals to take charge of their own well-being.
So not just relying on doctors and hospitals.
Right?
It's about people taking responsibility for their own health.
Exactly. And making healthy choices.
Healthcare extends beyond clinics and hospitals.
Yes. It's about lifestyles,
Okay.
community support, a collective commitment to well-being.
So those hospitals, ambulances, and technologies are all important.
They are.
But the real change happens when everyone feels responsible.
I agree. It's empowering. It's this shared responsibility along with strategic investments and innovation that will create a healthier future for India.
Okay. So we've covered a lot in this deep dive.
We have.
We've explored how India's healthcare system has evolved over time.
Right.
The challenges it's facing, the potential solutions. We even took a peek into the future.
We did. We talked about the role of cutting-edge technology and how individuals and communities can be part of the solution.
Now, before we wrap up, I have a question for you and for our listeners.
Sure.
Given everything we've talked about today, what role do you think community-based initiatives can play in all of this?
That's a really good question.
Like those local clinics, health awareness campaigns, support groups. Could these be the missing pieces?
I think they can be really important, especially in those areas where access is limited. They could be key to making healthcare more equitable.
So they can help bridge those gaps.
Yeah, exactly. So you have local clinics that can provide those basic services, health awareness campaigns to educate people, support groups to provide guidance and emotional support.
So it's about bringing healthcare right into those communities.
Right, and giving people the tools to manage their own health.
It's about empowerment.
Exactly. And it's not just about providing those services, it's also about building trust and making sure that those communities feel like they own their health care.
That makes a lot of sense. Okay, so we've talked about community initiatives, but as we wrap up this deep dive into India's healthcare system, I want to leave our listeners with one final thought. We've discussed all these different aspects: government policies, technological advancements, even personal responsibility. But what about those traditional medicine systems?
Like what?
Like Ayurveda or yoga. Could those play a role in modernizing India's healthcare?
That's a really interesting question. And it's one that's gaining a lot of attention both in India and globally. There's a growing movement to integrate those traditional practices with modern medicine to create a more holistic approach.
So it's about seeing the value in those ancient practices.
Right. Alongside all the amazing advancements in modern science, maybe there's a way to combine them to achieve even better health outcomes.
It's like this really cool blend of old and new.
Yeah, exactly. And there's actually a lot of research going on right now looking into the benefits of those systems and how to integrate them effectively.
That's exciting. Well, there you have it, folks. We've taken a deep dive into India's healthcare system. We've looked at its history, the challenges it's facing, and some potential solutions.
We even got a glimpse into what the future might hold, with things like cutting-edge technologies and the growing importance of individual and collective responsibility.
It's a healthcare system that's constantly evolving, trying to provide quality care to over 1.3 billion people, a complex landscape with a lot of hurdles, but also a lot of opportunities.
And the things we've talked about today, those lessons, they're not just limited to India. They're valuable insights for any country that's facing similar healthcare challenges.
That's so true. Thanks for joining us on this deep dive, everyone.
We hope it's made you curious about the future of healthcare both in India and around the world. Until next time, stay curious, stay informed, and most importantly, stay healthy.